Now I'm trying to look at another thing which is known as percutaneous crossed K wires. Okay, percutaneous crossed K wires. So they call them the Kirschner wire fixation. Okay, so I'm trying to look at this and its application and what conditions can you use this to repair. So for the percutaneous crossed K wires, that's basically for bone fracture repair. It's just these wires that they put inside the bone, and primarily they are putting this to stabilize the bone. Okay, putting that to stabilize the bone. So they are widely used, and mainly they are used for what? Stabilizing fractures that are unstable, especially in the distal radius, in the supracondylar humerus, and small bones of the hand and foot. Okay, so it will provide a lot of what? Reliable stabilization with minimal invasiveness. But it requires you to be careful to avoid any complications like all those injuries to any nerve or blood vessel around our region. So, what are the times that you might actually need to use these K wires, also known as the Kirschner wires? When there's a metaphyseal fracture, so fracture around the distal radius, supracondylar humerus, lateral condyle of the humerus, you use this. Then also small bone fractures, that's fractures of the phalanges, the metacarpals, the metatarsals. And also if the reduction is unstable, that's like they try to rearrange some bones that went out of their position but it's still unstable. Then also pediatric fractures, this is where you are feeling like the plates and screws might actually damage the growth plate. So you use these K wires. So technique overview is they usually what reduction in bones is you are trying to realign. One bone was like this, one was like this. You are trying to actually realign them in a straight line. So after you realign them, you know that it will still be unstable. If you leave it, it will still happen. So you basically use the percutaneous insertion of the K wires. So the wires are inserted through small stab incisions. So you cross them. You can see how you cross them. Okay. So the ends will now be bent. The ends that are outside will be bent. Okay. So it will be cut and padded to prevent skin irritation. So immobilization, short or long arm cast is applied depending on the fracture type. So after 3 to 4 weeks, after the fracture has healed, um, you basically what? You remove the wires, okay, so that the healing will complete. So for the time that you have put the wire, make sure you immobilize that region with cast or splint. Then there's a pain control where you use NSAIDs. Then pin site care. So you always clean that side because a lot of fluid will be going out of the body. You know, and you keep following up with X-rays. So later on now, you remove the wire and always you do it without anesthesia though, no need, because the person is already healing. So that's what we have for these K wires, also known as the Kirschner wire fixation.